Assalamu alaikum, everyone. Ramadanul Mubarak to all of you. Today I came live here so that we want to discuss some question that I frequently asked by many examinees. So the question is, what is the question pattern of Mrcpch Part 1 exam? We know that Mrcpch Part 1 has two parts, that is FOP and TAS exam. So in Mrcpch, basically there are around 95 to 97 questions in each paper. So for part 1 FOP exam, we will find two pattern of question. One is called extended matching question and another is called single best answer. So extended matching question, what are the extended matching question? First 7 to 9 question, you will see that in each question there are different answers, like 8 to 10 answers, and there are 3 different questions like A, B, C, and the answer will be different options, 8 to 10 options. So for each question, you will have to answer one option from those extended matching question. And another type of question is single best answer, that is straight cut. You will ask one question and there will be 5 options. So this is single best answers. Most of the question are single best, and we will find 7 to 10 question will be extended matching. So these are the question pattern for FOP and TAS exam. Now, what are the types of question we will find in Mrcpch part 1, that is FOP and TAS? We know there are 2 papers. In the morning, this is FOP exam, and in the evening, this is TAS exam. So FOP exam, we will find mainly clinical based questions, like we will be asked a problem, suppose Down syndrome. They will give you different points of Down syndrome, and we will be asked that if any child of Down syndrome has hypotonia and problem in walking, so what it can be. So the options will be different options, like hypothyroidism, like cervical vertebral problem, and celiac disease. So these will be the options, and you have to choose the best options. So this is FOP question. Now, what is the system that we will divide, and how we will prepare for each system and to get the maximum question? So first of all, we have to read the FOP cases book, and we have to understand the question pattern, how the problem-based questions are coming. And we have guidelines, pediatric guidelines and neonatal guidelines. So we have to follow the management portions from those guidelines. Now, today I am here to discuss some question pattern that are frequently asked in Mrcpch from the recall. So what is recall? Recall questions are very important. Recall questions are past year's question. So frequently they are repeating these questions. So you have to solve the recall questions, and these recall questions, whenever any student give exam, they try to recall the question, they write down and they share with the friends. So this is called recall question. So for recall question, there are few mistakes, as we remember it after giving exam. So you have to be very careful when you solve those recall question. So from the recall question, we know that the question pattern are mostly clinical based question. In any question, they can ask about diagnosis, of any syndrome. There will be a pedigree, and you have to answer what is the type of the pedigree. Is it autosomal recessive? Is it autosomal dominant? So you have to understand the type of the pedigree. And also some question will be management basis, like what is the management of diabetic ketoacidosis if the child comes with dehydration more than 10%, or the child is having features of cerebral edema. Now this, we have to remember that the FOP exam and TAS exam, part 1 exam, this is a very basic trainee level exam. So you will not be asked a question that is, the intervention is needed by the consultant, so that much difficult question will not be asked. You will be asked like emergency management of diabetic ketoacidosis, so that when a patient comes to us, we can give the emergency management and we can activate the chain of our consultant, and we have to involve the consultant and other personals. So basically you will be asked very basic questions, very basic management, so no need to worry. And if you read the guidelines, most of the guidelines like pediatric red book, pediatric blue book, most of the guidelines have all the answers. But you have to read the guidelines technically. I mean, you have to think that which line, which part of the guideline or management will be asked in the question. So for that, you have to be prepared of the question pattern. That is why I came live here today to discuss about the question pattern of Mrcpch part 1. So as we know that there are two kinds of two paper. Part 1 consists of FOP in the morning and TAS in the evening. So FOP is basically clinical exam, and TAS is very basic exam like pharmacology and microbiology and pathophysiology of a disease, statistics. These are the question pattern of TAS exam. Similar to the FOP exam, TAS exam also has 7 to 10 extended matching question, and rest of the 70 question, around 70 question, you will get single best question. So for FOP and TAS, your preparation is a little bit different, and for FOP you mainly read guidelines, and for TAS you mainly read a science of pediatrics books, statistics books, pharmacology books. Now, during the exam hall, when you sit to give an exam, first of all, you have to be very calm, and you should not be very stressed, because stress will make your easy question, you can feel it is difficult. So no need to be stressed. And usually, question begins with the extended matching question. What I feel that extended matching questions are a little bit tough. So it will make you a little bit wastage of time. So what I started question number 8. That was the single best question, and I kept 30-minute time for the rest 7 question. Total examination was 2.5 hours, 2.5 hours. So I kept 30 minutes for extended matching, and within 2 hours I finished 70 question, so that pass mark is ensured with this 70 question, because most of the question I could answer in a cool brain. And then at the last 30 minutes I solved the extended matching question, because extended matching questions are a little bit tough, tricky, because from any system uh, the extended matching question can be formed, like neonatal seizure. So in the neonatal seizure, what are the causes of neonatal seizure? Suppose neonatal sepsis, metabolic disease, hypoglycemia, dyselectrolytemia. So in this category, 3 scenario will come, and we will have the answers, 8 to 10 answer, and we have to choose one answer for each question. Similarly, diarrhea, there will be 3 questions related with diarrhea. It can be Crohn's disease, it can be celiac disease, and it can be acute watery diarrhea, or it can be due to infectious diarrhea, it can be chronic diarrhea. So this diarrhea, there will be 3 questions and you have to choose among the answers. So this extent matching question I feel a little bit tricky. That's why I choose to give it at the last 30 minutes. But if you feel that extended matching questions are easy for you, it depends. It depends according to the person to person. So if you feel that extended matching questions are easy, coming easy, then you can solve within 30 minutes. But you have to keep in mind that within 30 minutes, I have to finish the extended matching question, because I have to answer 70 questions for single best answers. And timing is very important for Mrcpch, both part 1 and part 2, because most of the questions are easy. You remember the question. So if you waste your time on a difficult question, then easy question will miss you. So what I suggest, if any question is very difficult, then you make it a flag, and give the most possible answer. Don't keep any answer empty, because there is no negative marking in Mrcpch. So we have to give each and every answer, whether it is wrong or right. So, and another rule is that whatever the question is, how much difficult it is, if you choose an answer first time, this is the best answer. Most of the time, you will see that the first answer is the best answer. So you will give answer and you will make a flag mark, so that after you're finishing your exam, you can come back and you can review the answer, right? So by this method, I hope, inshallah, you will answer maximum question. And in my last batch, Mrcpch, I had around 99% pass students, and most of the students said that a question pattern was relatively soothing, and after the sessions, after our teaching sessions, they find that it was not so difficult. So these are the question, and you have to answer this. And now few question I like to discuss from the recall, that from the past exams, that which frequently comes in exam in FOP and TAS. So suppose in FOP exam, 3 scenario will come from syndrome, like features. They will give you facial features, body features of Marfan syndrome, Sotos syndrome, and homocystinuria. These 3 kids are tall. Okay, so tall stature. They will give you this 3 scenario about tall stature, and you have to answer. There will be 8 to 10 options, like homocystinuria, Marfan syndrome, Sotos syndrome, Beckwith-Whiteman syndrome. There will be cerebral gigantism. So among these options, you have to choose the single best option for each question. So like this, whenever you read any chapter, suppose you are reading genetics, suppose you are reading short stature or tall stature or obesity or dyselectrolytemia, there can be 3 scenario of dyselectrolytemia. Hyponatremia, suppose. There are many reasons of hyponatremia. It can be congenital adrenal hyperplasia, it can be Addison's disease, it can be diarrhea. So there are many causes. Furosemide ingestion can cause hyponatremia. So you have to think, what is the cause of hyponatremia in this child? So after reading this scenario, you have to match the scenario. And while you are taking preparation for FOP exam, basically you keep in mind that the question will come as a scenario based, and they will give you some facial features, some investigation reports, and you have to answer the most suitable answer for each question. Now similarly, for TAS exam, their question will be like a very simple question. TAS is a very basic exam, so the question pattern will be interleukin 6 blocker. Which drug blocks the interleukin 6 receptor, and which drug is tumor necrosis factor inhibitors, TNF alpha inhibitors. So this is a simple straight cut question from the immunology. And also which factor is released from muscle during anaphylaxis? This is a very simple question. And at about which week the diaphragmatic hernia occurs? So these are the task questions, very simplified and very basic question. And from statistics, they can give you the data of some sensitivity related data, like some disease population, and we can identify by some screening test, and some person who are disease free, and screening test was negative. So you have to construct a block, a block, I mean a chart. From that chart you have to know which one is false positive, which one is true positive patient, which one is true negative patient. This question is very common in Mrcpch, that is specificity and sensitivity. So how to calculate this specificity and sensitivity? This will be one question in TAS exam. From pharmacology, they can give you side effect or mechanism of action of any drug. Most favorite drugs are anti drugs used in asthma, drugs act on kidney like diuretics, anti-epileptics drug, anti-hypertensive drugs, okay, then diabetic drugs like insulin, metformin. So these are very very common question in part 1 TAS exam. So same pattern of question, like there will be 7 to 10 extended matching, and rest of the 70 question will be single best answer. So the main point is that while you are solving question in FOP and TAS exam, you have to divide your times. Divide the time for extended matching, divide 2 hours time for single best answer. By this method, your time will be maximum utilized, and you will not miss any question. And another important point is, if you don't get any answer, if you don't remember any answer, or it is totally unknown to you, just don't hesitate to put the most suitable answer and then go on. Put the flag mark and then go on. Don't waste your time by thinking and thinking. Okay, finish your paper, then come back again with the flag questions. So I hope this video will help you in giving exam of open tasks, and how you will divide your time, and what is the question pattern of open task exam. So if you have any more question, you can ask me about below this question box, below this comment box. And also I will give you the link of my channels, that is Telegram channels, and my contact details, so that for the upcoming part 1 course you can contact. And if you have any question, just comment on the comment section. Okay, I hope you like the video, and also it will help in your exam. Best of luck for your future exam, and keep studying, enjoy the study. Okay, thank you all. Assalamu alaikum.